Hello guys, my name is Asoma Isaiah Patuwing. I'm a University of Ghana Science Medical Laboratory student, and the reason why for making this video is because of an issue that happened around our area about someone having a heart attack, and the wife couldn't, you know, drive, so she didn't know what to do, and then the husband died, and it was such a tragic story. But right here, right now, I'm going to talk about heart attack, what to do when you have a heart attack, or someone, your sibling, your friend, your loved one, have a heart attack. What is a heart attack? A heart attack, or myocardial infarction, is a blockage of blood flow to the heart muscle, mostly due to buildup of fat and other substances in the heart arteries. This is called plaque. So the lack of blood flow can will damage or destroy part of the muscle. Symptoms of someone having a heart attack: 1. Chest pain that may feel like pressure tightening pain or discomfort spreading to the shoulder, arm, back, or neck. 2. Nausea and vomiting. 3. Shortness of breath. 4. Lightheadedness or dizziness. 5. Heartburn and other discomfort at the upper part of the body, that's the thoracic part of the body. What do you do if you see someone having a heart attack? The first thing you need to do is to call any emergency number. So it is good for you to know any emergency number offhand. So if in the US, you call 911. If you're in Ghana, you call 112 or 193, or any place you find yourself, you need to know your local emergency number and call. That's the most important thing you need to do when you see someone having a heart attack, or you have a heart attack and you are having a phone around you, or you can reach your phone or any telephone, anything. Just call emergency number as soon as possible. That's the first thing you need to do. Second thing you need to do is to take aspirin. Yes. Note, this should be recommended by a doctor because taking aspirin can interact with other drugs, certain drugs that maybe you are on. But taking aspirin may reduce heart damage by preventing blood clotting. Not for long, but for a while. It buys you some time. So, but don't use an aspirin as a way round people who have a heart attack. Instead of you to go to the hospital, you're taking aspirin, you think all is done. No, the repo will come for you. 3. Only perform CPR when someone is unconscious and you think they have a heart attack. So what you need to do first is still call the ambulance. If you've not yet done that, just call the ambulance or any emergency number you know, and check if the person is breathing and has a pulse. If the person has none, then perform a CPR. I think for CPR, in my next video, I'll be talking about CPR and how to perform CPR. So please subscribe and like the button. Press the like button, subscribe, and also hit the notification bell so any video that comes, you can get in touch with. So, factors that risk you of having a heart attack. 1, of course, age is part. The older you get, the higher the chances of having a heart attack. So, according to Mayo Clinic, men aged 45 and older and women aged 55 and older are more likely to have a heart attack. 2, tobacco use. Any long-term exposure to smoking and secondhand smoking, or maybe you standing around someone who's been smoking and inhaling the smoke, can also lead to a heart attack. That is long-term exposure. 3, high blood pressure. 4, high cholesterol or triglyceride is most likely to narrow arteries. The high cholesterol specifically the low density lipoprotein or bad cholesterol, clogs the arteries. and prevents blood flow, so can also cause a heart attack. 5. Obesity. It is linked with high blood pressure, diabetes, bad cholesterol. So that one can also cause a heart attack. 6. Diabetes. 7. Not enough exercises. You lazing around, not moving around, not having exercises can also, increase the risk of having a heart attack. Stress is also part. Illegal drug use. You taking drugs that have not been prescribed by the doctor is also a risk of having a heart attack. You taking it, frequently, mostly, can increase your risk of having a heart attack. And unhealthy diet. So unhealthy diet has to do with you taking it too much sugar, you taking it too much cholesterol food or triglyceride foods and all this kind of stuff can also increase the chances of having a heart attack. Thank you for listening to this, and I know you were a step away to prolonging someone having a heart attack, prolonging the life of someone having a heart attack. When you do this, you buy some time for the person. It doesn't mean that you've saved the person's life completely. You've extended the lifespan for some few hours. So you still need to go to the hospital. You still need to make the person go to the hospital. Don't drive when you're having a heart attack. Don't do that. Let someone else drive you to the hospital if in case you don't know the emergency numbers don't go through. So this is just like a first aid to help you prolong your life a little bit from the Ripper, so that you can save yourself, so that the hospital or the medical practitioners can actually save you. Thank you very much. This is the Assam Effect, the Health Illuminate chapter, episode 1. Follow, subscribe, and then hit the like button. Also hit the notification button so that you can get more. Thank you very much.